Howdy, this is your Houston chiropractor, Dr. Tristan Went, coming to you from Advanced Chiropractic Relief in Houston, Texas. And today I'm joined with Carlos. Carlos is a local Houstonian here who's a construction worker. He's coming in for his very first adjustment today ever by a chiropractor, is that correct?
Correct.
Carlos is dealing with primarily some neck and low back pain, which is causing some bilateral, but primarily right-sided numbness and tingling and sharp shooting pain into the C7 and C8 dermatomes, which are going to be that middle finger and the pinky and ring finger. Previously, about 18 years ago, he had a surgery for his cervical spine where they went through, replaced the disc, and then actually fused with instrumentation in the cervical spine. That was lower cervical, C5, C6. He also had a surgery where they did a disc replacement in the low back a little bit after that one, correct?
Mm-hmm.
Or is it vice versa?
Yeah.
Vice versa, lumbar and then cervical spine?
Mm-hmm.
Yep. And so he's still dealing with low back pain, bilateral SI joint pain, paresthesia or numbness and tingling into the calves. Again, primarily on the right side, but he does get it occasionally on both. And he also, just like myself and what brought me in, he gets the sharp shooting leg pain into the posterior aspect of that calf muscle too, which is the L4 nerve roots. So he's dealing with a lot of compression from all the years and years of being a construction worker. And he also took a 20-foot fall off of, was it a ladder that you fell off of, or a cherry picker? Fell off a roof. So he took a 20-foot fall where he landed on that right-hand side, fractured the wrist, had to have an ankle surgery as well, and then actually fractured his nasium and had to have some implants also in the dental area, correct?
Mm-hmm.
Yep, so he's dealing with a lot of compression from that. He's never been adjusted or decompressed before, so we're gonna memorialize his first adjustment here in the office today. So Carlos, I'm gonna have you go face down into that paper again, just like we started today. So I'm gonna have you go right here for me. Oh, we'll do posture analysis. You're correct. I'll have you stand up one more time. You know it better than I do here. So we'll do a posture analysis. Again, I've already looked at all these things and made all my notes. That's why I was kind of jumping into the next gig here. So Carlos, I want you to bend that head forwards and backwards like we did earlier. Yep. And you can probably see this on video. That kinks up when Carlos gets into that extended position there. And he feels that pulling sensation going forward. As long as we come back to neutral now. Good. And we've already gone over this. Carlos is primarily dealing with that forward head posture with right translation, but he's rotated to the left. And he self-admitted to being a stomach and side sleeper already. So I already knew these were going to be some of those findings. Also, if you can see here in the video, we've got less room on that left-hand side than we do on the right-hand side. So his pelvis is also translated to the left. But he came to the right place to get straightened out today, huh, Carlos?
Yes, sir.
So have you go face down here for me. So since this is Carlos's first visit, we're going to start on the BioPhysics table so I can get a feel for his spine and pelvis, and then we're going to put him on the ring dinger table to decompress him for the first time. So in this position, Carlos is short on the right by about ½ an inch. As I bring those legs up, it gets longer by the same distance. And I already asked Carlos this, but that tightens up in that low back and pelvis, doesn't it?
Mm-hmm.
Yeah, so remember what that sensation feels like. We're going to check that here in just a second, all right? So I'm going to start on that right SI joint like we talked about earlier. You've got the easy job. All you got to do is breathe and relax, okay? Good. So starting on his right SI joint here, contacting the medial aspect of that PSIS. And we're applying a thrust with a 45 degrees down and away, posterior to anterior and medial to lateral. Good. And for sacrum here, we go straight S to I, or superior to inferior. This helps create some traction between that S1 and L5 area that takes the most weight of the entire spine. Good. Now I'm on the left SI joint. Perfect. All right, Carlos. So next, I'm going to work through the low back, and these might be a little bit tender since you've never been adjusted before, okay? Okay. But don't worry, they'll feel better when they quit hurting. All right, big breath in through that nose for me. All the way out. Good. So L4, L3, straight P to A, L2, P to A with a little bit of an I to S. Yes, sir, I know you felt that one, Carlos. Last one here, big breath in through that nose. All the way out. Good. All right, so next we're gonna work through those thoracics. Carlos is primarily dealing with the neck and low back pain, so he hardly ever notices the compensatory tightness that he's been experiencing here in these thoracic regions. So maybe take a nice deep breath in through that nose, all the way out. Oh boy. Move the earth on that one, huh? You've definitely been needing this, my friend. Big breath in through that nose again. All the way out. Good, one more here. There we go. Sometimes it just takes a little extra force for the bigger patients. Because you've been dealing with this compression for so long too. Might need to see 1 or 2 visits to get the full decompression, but that's all right. Big breath in. All the way out. Good. Let those shoulders just kind of sink and relax for me. There we go, last one. Perfect. All right, so we're gonna check the leg lengths one more time here. So Carlos, you are exactly even now in the extended position. As I bring them up, they stay even. Does that feel any different in that low back and pelvis this time?
Yep.
What sensations do you feel now?
Feels free, like loose.
Good, that's exactly what I want to hear from you. All right, so next we're gonna work on that forward head posture. You feel the table popping up underneath you? Last one. Good. Have you go face up for me now, please, Carlos? A little deeper than the videos you've seen, huh?
Face up?
Yes, sir. So for this next one here, I'm going to contact on the cheeks on either side, and work on getting that head back up over your shoulder. All right? Last one. Perfect. Now maybe your arms out to the side like a big old T. Next I'm going to work on, I'll have you scoot down just a touch for me here. Work on the AC joints, the sternoclavicular joints, and those anterior ribs as well. Goes next. Two more. Last one here, big breath. All the way out. Perfect. So next time I have you relax those hands on your tummy. I'm going to start by decompression you from the lower end today. We're going to make it taller from both ends, Carlos. Big breath in through that nose for me. All the way out. Good. So you should have felt that from the knee all the way up into that hip and low back. We'll be with you in just 1 second.
I'm here to work on the air conditioning.
Okay. We're shooting a video right now, but then I can come grab you in just a second. So. Alright. Just had a maintenance guy walk in, coming to do some work on our air conditioning. If you can't see in the video, I'm sweating already. That's because we've been having some issues. There we go, Carlos. Do you feel that into the hip as well on that side? Perfect. Have you sit up with me next. And I want you to swing those legs all the way around for me. All right, so next I'm gonna work on the shoulders, elbows, and wrists on either side. Good, you've got a habit here of dropping that head, so I want you to focus on outside of the office, making sure we're keeping that cervical spine up over the rest of our spine. Because again, for every inch of that forward head posture, 10 to 15 extra pounds of pressure and stress that we're putting on those muscles, ligaments, and discs. Good, so I want you to relax that elbow for me. Perfect. Look up at the ceiling. Good. You're sounding off for the crack addicts today. Last one here. Look up at the ceiling for me. Nice. The shoulders have been needing that for a long time too, huh?
Yep.
Perfect. Radius. Good. See how easy that habit is to fall back into. So that's something I'm gonna need you to work on outside of the office, okay?
Okay.
Because I can adjust you from now till never, but if we don't change some of the things that are bringing you into my office here, those same symptoms and issues will keep arising. That's where we're gonna put the ball back in on your court on that. And I'm gonna show you some other stretches and exercises to help yourself out along the way as well, okay?
Okay.
All right, same thing on this side. Ulna first. Radius. Good, there you go, I saw you thinking about it. Perfect, that's what I need right there. So I don't want you to get nervous or anxious if you find yourself getting into that flex position. Just use it as a learning opportunity to say, hey, I'm falling back into those patterns that I need to start working on breaking down. So I don't have to go see Dr. Winda's office. fingers. There we go. All right. Now the one that's really gonna set you free here, Carlos, ring dinger. Have you go butt right here, head up this way for me. So this adjustment right here is the entire reason I decided to become a chiropractor. This helped save me from back surgery when I was 19 years old. Like I told you about, I had a herniated disc in my low back that was causing that sharp, severe leg pain into that exact same nerve root that you're experiencing then. And like I told you earlier, this is also that gold standard sleeping position that I want you to start working on. So when your legs are completely elevated and parallel with the floor like this, what it does is it rotates that pelvis backwards and flattens that lumbar curve and relaxes all those muscles all the way up and even to your skull. So the other thing too, I don't want you using a big old pillow, because what does that do? Props right back up into that forward flex position that I can already see you have a habit of getting into. So you want that head all the way flat back up against the bed, because right here you have a nice normal cervical lordosis in that spine. Let's have our opinion here, huh? Have you relaxed the hands on your chest here for me? Perfect. Now these are going to be very, very tight, and they need to be, okay? There we go. Got the squeeze on you now, huh? Carlos, the main thing I want you to focus on here is keeping those teeth together. You don't need to clench them together, just touch them so that tongue doesn't get between there. Just a touch. We're back. I want you to take that same nice deep breath all the way in through the nose for me. And blow it all the way out. Good. And wiggle that left big toe for me, Carlos.
No.
Yes, sir. Bottomed you out on that one. Nice deep breath in through that nose. And all the way out. Let those legs sink and relax into the table. Hear that breath of relief there, huh? Mm-hmm. Now, Carlos, you should have felt that all the way down, did you?
Yeah.
Perfect. So, just for old time's sake, look, he's still kicking. We're not checking to look for any upper motor neuron lesions. People are always trying to think that we're going to rip somebody's head off or something like that. What you guys don't see on video is the thorough history and exam that I did with Carlos before I even laid a hand on you. Is that anything similar to what you got at any medical doctor or hospital that you ever went to?
No.
Probably a lot more in depth, huh? We like to sit down and actually have a conversation with our patient to figure out what's going on with them before we even lay hands on them. And that's something that really intrigued me about coming to this practice as opposed to other chiropractors and medical doctors that I used to go to. So I want you to tilt this right ear to the right shoulder with me. There we go. I'm not gonna fight you on that one. So one more here on that left-hand side. Nice deep breath in through that nose. As you let that air out, I want you to let those shoulders just kind of sink and relax into the table for me. There we go. Yes, sir. All right. So next, Carlos, we're gonna get you back in front of the mirror and see how much we straighten you out for one visit, okay?
Okay.
So another thing too, I want you to start working on getting up sideways, so I want you to roll to that hip. Good, just like that.
Okay.
Perfect. So next, we're gonna stand back in front of the mirror. Are you looking a couple inches taller? So good. I want you to close those eyes one more time, bend the head forwards and backwards like we did to start the visit. And back to neutral. Much better range of motion already. Can you feel that?
Much better.
Yes, sir.
Yeah.
Look at that spacing between the pelvis now. We're even on either sides. Those shoulders are nice and squared off, not only from the front, but also laterally as well. Got the head much further back over our shoulders. Still got a little bit of work there, but that's where it might take 1 or 2 visits to get you stabilized. This big gun here is going to relax these big paraspinal muscles. This gun's a lot deeper in person too, huh? Doesn't look like it does all that much on video until you get it in here on your spine. So Carlos, next we're going to go over that foundation homework. So this is what we're going to build any other exercises and stretches off of, is this guy right here. So it's 3 parts. Part 1 is going to be shoulders up, all the way back. Good, kind of like you're giving me a hug back here as much as you can. Part 2, I want you to watch my chin in the mirror. So we're going to go straight back to the wall behind us. Good, now look as far back as we can, just like that. This is the only time that you will hold this position is right here in the office, getting that adjustment done right there. So relax those shoulders. Good. One more time, I want you to go forwards and backwards. Should feel even smoother this time.
Yeah.
I could put some WD-40 in there. Here's my grease gun.
Yeah.
So Carlos, you walked in today at a 4 out of 6, or excuse me, 4 out of 10 on the low back. How would you rate that right now after visit number 1?
I don't feel.
Pretty cool stuff, huh?
Yeah.
That ring dinger's something else, isn't it?
Yep.
So with the ring
Yeah,
dinger
right
right there,
difference.
what we're doing is we're taking the compressive stresses off of all those discs and off of all those joints that are causing compression onto the nerve root, which is why you're getting all those symptoms down the leg. And we just got rid of all that compression in there.
Wow,
So,
man, you did good.
thank you so much
Thank you
for
so much.
memorializing
Thank
your
you
first
so
visit
much.
here with the Crack Addicts on YouTube. How would you kind of compare this experience to any of the other doctors or procedures that you've had done in the past?
Well, this is a whole new experience for me, you know, but I recommend it to everybody. It feels really good. It's not painful, and it works. That's the main thing.
And there's a lot more that goes on than just wrapping a towel around your neck and yanking, huh?
Yeah.
A lot more of a history and exam than a lot of people like to think. So,
Yep.
again, appreciate you sharing your story with the Crack
Thank you
Addicts
so
there on
much.
YouTube.
Thank you.
Again, this is your Houston chiropractor, Dr. Tristan Went, coming to you from Advanced Chiropractic Relief in Houston, Texas, with Carlos from Houston. We'll see you guys soon.